So there's a lot of different options for pain control techniques during labor, and it's a very personalized choice for different women. Some women prefer to stay away from medications or medical interventions during labor, which is great for them. There's different things that people do. During labor itself, we can try different positioning techniques. I think getting in the tub for a period of time, if it's a lower risk pregnancy, especially, is a great way to control pain during the early or later phases of labor because it helps relax the body. It does control pain. Sometimes people use a birthing ball or allow natural movement during labor too. Women should be allowed to walk around, to move as much as possible. And that encourages the labor to progress and also helps with the pain. For some women, that's either not enough, or they kind of know off the bat that they want to do something more in terms of medications during labor. And that's also very effective. We have several different things that we offer at our hospital. One of those can be like an IV medication or an IM medication, which would be intramuscular, like an injection. We use medications like morphine or Phenergan as an IM injection, which would be intramuscular, especially during the early phases of labor, to help kind of take the edge off and help women relax. Later in the labor, we'll use shorter acting IV narcotics like fentanyl, and that can also help with the pain. Other women might want an epidural or an intrathecal, which numbs the body from about the belly button down, and is a very effective method of pain control in labor. The downside to an epidural or intrathecal is that because you're numb, you don't really know what your legs are doing, so you're not able to walk around as much. But it is an extremely effective method of controlling pain. The newer thing that we've offered at our hospital, at Boone County Hospital, is nitrous oxide, and it's an inhalable gas, the same one that people might think of as laughing gas when they go to the dentist. The nice part is that it's patient controlled. Most people use it only during the contractions. If they're having a more intense contraction, they can take an inhalation of the nitrous oxide and breathe out the gas. It's a very rapid onset and also out of the body in a very short period of time. It does work very well to help with pain and a bit of dissociation. Maybe less effective in terms of an epidural in terms of overall pain control, but for women who are hoping to avoid an epidural or didn't have a great experience with the last one, or it's just not going to be their cup of tea, nitrous oxide is an excellent alternative as well. Some women who are very motivated in terms of avoiding medications and going toward a natural childbirth are going to elect to do something more intense like hypnobirthing. It definitely requires more time and energy from the beginning, and people have to do some training throughout it. So I suggest people who are interested in this start early on in the pregnancy. It used to be that you could attend only in-person classes and maybe read a book, but there's so much online information about hypnobirthing anymore that you're welcome to take an online course. And some of the meditation techniques are not only helpful during labor, but helpful for some of the other really bothersome symptoms that come up during pregnancy. Low back pain, painful uterine contractions that can be intermittent, like painful Braxton Hicks contractions, and insomnia are extremely common bothersome symptoms that plague people throughout pregnancy. And sometimes the hypnobirthing techniques can help women cope with those along the whole pregnancy and not just during labor.